Good morning, and thank you very much for tuning in to Spice FM. This is a Situation Room. It's the country's only talk show in the morning, full-on talk show in the morning. In the room, my name is Eric Latif. We have Ndu Oko, CT Muga, and joining us on the line now is Dr. Githinji Gitahi. He's the Chief Executive Officer of Amref Health Africa. Good morning, Dr.
Good morning, Eric, and good morning to your colleagues.
Good morning, Dr.
Good morning.
Now,
Yep.
Doc, asante sana for joining us. You've been, as all other medics right now, this is your peak season. You're all very busy looking at numbers, looking at how best to address this situation as a country.
That's true. It's been a very busy season, yeah.
And I saw that you released a statement just the other day, and you were saying, Kenyans, brace yourselves. This is going to last at least 4 to 5 months.
Yeah, that is true. Eric, I actually posted it on my on my Twitter page as a thread.
Yep.
And then a clever Kenyan actually saw the statement, picked it up, put it into a post, added my photo, my title, and circulated. So I wish I could know who that was, because now it's gone viral. I'm getting it from Amsterdam, from China, from Nigeria, Ghana, South Africa, everywhere. My tweet was just resting there peacefully until this guy put it onto this thing. And whoever it was, good job.
They've done quite well. So
Yeah.
explain, why are you saying that we need to look at it as a 5 months kind of issue?
I think this is really what I would say is a no-brainer. The issue is this, that if you look, let's just look at China, where this thing started.
Yep.
They started seeing this unknown disease in November last year. And they had a phase where they couldn't identify. They knew there were people getting pneumonia, they couldn't identify the cause, and people are dying. And then by December, they realized, yeah, this is a new virus, we have never seen this, and now that's when it came out to the world. That was December. Where is China now? China now is considering releasing or kind of relaxing the lockdown in Wuhan.
Yeah.
This is April, starting in December.
Yeah.
And you know the response of China was actually a mallet. It was heavy on resources, heavy on response. And even now they're still afraid that even after they relax the lockdown, the populations in China who may never have gotten exposed to this because of the success of the lockdown are likely to have a second wave.
Yeah.
So if you just look at China, we are talking already 4 months. So I do not see why then our people, across Africa, Kenya, would think that we have a shorter phase. Countries like Italy have been going on since January. This is April. So we are saying basically the measures we are taking will go on until the transmission starts to decline. If we have not even started the peak will start maybe May, June. Then you have another month to add to make sure all the things are tied up, you're sure the lockdown is working. So it's basically minimum 4 months, 5 months of these social interruptions. It's a no-brainer. It's just looking at what other countries have done, where we are, the progression of every country. Brace yourselves for 4 months
For the long haul.
Dr. I'm going to ask you then, with what you're saying now and what we've heard, just from the last 20 minutes, let's not even talk about 1 week. There are people who don't believe this thing is here. How are we then going to tell them to hunker down for the next 4-5 months when there's some people who believe this thing doesn't exist, or that there's a cure for it that you can get at 2 a.m. in the morning? How are we going to pass on this message?
It's going to be tough. I think, you see, populations are cynical not because they want to be. Communities are not cynical for the sake of it. They're cynical, number one, is because there's a trust gap between their government, the communities and their government. There's a trust gap. And that trust gap is not purely on COVID-19. We've seen this kind of cynicism for several years now, where the government says we've done, these guys are like, you did not do it. So it's not new. It really is not new. And but remember also that if you talk about a typical Kenyan living their lives, maybe, a huge percentage live below $2 a day. They earn day to day, and they are feeding their families. They have other priorities. Their priorities are, how am I children going to feed? My child does not have universal coverage, and therefore they are sick. What do I do? How do I pay for it? I don't have money to pay the loan I borrowed on my mobile phone. So these are the bigger priorities, and they are lively. They are alive. They can see them. They can feel them. These are the things which is being talked about on media, which doesn't have a face.
Yeah.
Actually, somebody the other day defined COVID-19 as a ghost.
Right.
It doesn't have a face. You can't show a poster child. You can't show a poster person and say, this is how it looks.
Yeah.
So how then, the disconnect is real.
How do people resonate?
Yeah, how people resonate. And to your question about, therefore, what do we do? It's going to take time for people to start seeing the effects. The first effects they're going to see are the economic effects. We have seen people losing their jobs. We've seen businesses closing. We are going to see more numbers coming up. People will never see those faces. Even when we get 10,000, people will not see the faces. People see Brenda and they're like, no, you didn't have COVID-19. You look so healthy. Why you like to us?
This is the thing. But with other pandemics that we saw, Dr. Terry, if I can just go before and to ask another question here, is that look at most recently Ebola, we could see somebody suffered from Ebola, it resulted 50% in death. And we could see what happened to a person's body ravaged by this disease. We looked at HIV that we've dealt with and still continue to deal with, where 36 million people around the world lost their lives. And then you could see on someone's body if they suffered from this disease for some time. So I can understand what you're saying here in the sense that people have not been able to reconcile with this thing that doesn't look a certain type of way. And we're likely to see the results from other sectors, other factors, before we understand how bad this thing really is.
Yeah. So let me come to that, and this is the real. What you're raising is the crux of the matter. Coronavirus infects you. When it infects you, 80% of the people, 8 out of 10, will have very mild symptoms. It will be like you had a flu passing, and it goes away.
Yeah,
and that's the majority. The challenge is that you may have another 2 out of 10 who need hospital care, and they need ICU beds. So why is there so much noise about coronavirus? The rate of transmission is so rapid that actually you worry about the 2 out of 10, not about the 8 out of 10. Okay? Now, imagine, somebody yesterday described to me and said, imagine if there was rain that came, all of it came over 2 days and flooded the entire town.
Yep.
Cars were floating and houses were floating. Imagine the same rain, but you spread it over 2 months, and therefore it's just showers over 2 months. Which of the two will have the most drastic event? It's the one that comes over 2 days.
Yes.
Okay? So the question about this coronavirus is, how do we stop the rising numbers so that we stop the 2 out of 10 from needing hospital care? This is why the noise around it. Ideally, the 8 out of 10, you'll not even know they will have mild symptoms and they'll move on. But the challenge is, if you do not identify them and isolate them out of the community so that you allow slow transmission, then it means you have many of the 2 out of 10, and therefore your health system gets overwhelmed.
Right.
That's where the issue is. It's not the 8. It is the 2 and the capacity to deal. If the 2 is multiplied by 10, by 100, by 1,000, then what is your capacity to deal with those numbers? That's really the issue.
Also, Dr. You mentioned the peak. We haven't reached the peak yet.
No.
How would the peak look like?
The peak in terms of infected people is going to look like thousands of people. There are many different projections. We have projections showing, and I think even the Minister of Health talked about this, by April, May, we are likely to see 10,000. My estimate is that we may hit 10,000 by mid-May. Now, and then that doesn't mean that that's the peak. That just means that is the acceleration phase. So we probably will have 20,000, 30, 40, 50 going up. Now, how will it look like? We are not going to have 50,000 sick people in the hospital.
In the hospital, yeah.
We will only have, maybe we'll have 1,000 sick people in the hospitals who need care. Out of those, another, 500 or so more will require ICU beds, okay? So what are we likely to see? We're likely to see many people requiring ICU beds, maybe double the number we already have, because we already have people requiring ICU beds. So maybe double or triple the number of the people we have, and we'll need hospital beds because maybe we'll have triple the number of beds we have. But these other people we don't see in the hospital, what are we likely to see out of them? We are likely to see massive isolation centers to get these infected people out of the community to stop the spread. So you're likely to see schools, universities, stadiums stand in isolation centers for healthy people, but with positive coronavirus tests, who are then put there to stop the spread to other people. That's what you're likely to see. Of course, then you'll see massive disruption of the economy, because to stop the transmission, you have to stop public services, you have to stop people going to public places. So you'll also see this curfew extending and maybe seeing more and more disruption of people's daily lives.
This picture that you have painted, is it despite the efforts we are making? Is it in spite of the efforts we are making? Is it something that we can put a halt to if we can project clearly and see what can happen? What is this thing that we can do so that this disastrous looking and sounding outcome doesn't become a reality?
So what can we do? I would say that the picture I'm painting is in spite of, okay? And the magnitude of that picture, the size of that picture, whether it's a small portrait or a big wall hanging, depends on the things we do now. The things we do now will mean that we need to test. Our capacity for testing is still not where it should be. And it's not because of failure of government. It's just because globally the test kits have a major supply issue. They are not available. So, but we have seen yesterday, I think the minister said we probably tested the highest number in a day, 700, 600 and something. Now we need to test 5,000. We need to test 5,000 in a day. So we need to get there, because the more you test, then the more you can isolate the sick and then reduce the peak. Okay, so if we're able to increase our testing capacity rapidly, we then identify the sick people, the people who are positive, put them away, and therefore reduce the rate of transmission. That's number one. The second thing is ourselves, the public. If we can actually take the measures, we advise work from home. If you can work from home, as we know, majority of Kenyans cannot, because if you're a mason on a construction site, you can't work from home. You have to go to the site and actually do the work you do every day. Then it means that there are measures you can take. The government hasn't done a lockdown because the government is worried of those people. Therefore, we are saying, then wear a mask when you're in a place where there are many people. If you're in a matatu, wear a mask. When you get to the construction site and you're meeting many people, wear a mask. The rest of the time, maybe you may decide not to have a mask if you're with your family or you're around, an environment where there are not too many people. Then wash your hands consistently. Don't shake hands, because when you shake hands, then you increase your chance of transmission. So if you take these measures, then we could see that this picture could be better. Not that we'll eliminate it completely, but we'll slow down the rate of spread, the rate of infection.
But also still looking at the issue of isolating people. Everybody who tests positive is then removed from the community and being isolated. It also still paints a grim picture, because we're talking about removing people from where they live and taking them into some boarding school somewhere, and they're living in dormitories. Must we do this? Can we just not tell people, all right, so you are infected, you've tested positive, let's see, are your family members positive? Maybe they are, maybe they are not. Just leave, don't leave the house.
Now, this is a very important and controversial issue. Many countries have attempted to do so, to say, fine, you are positive, please isolate yourself from home. Now, Italy, which is I would say, I would say that it has a more formalized society, where houses have addresses, where roads reach every house. They attempted that, and they had one of the worst, what we call cluster infections. I think maybe a big more than 50% of all infections are family related. Okay, this is because even when you tell people to isolate, there is no 100% separation. People even stay in their room, but there will still be somebody giving them food in a plate, and that plate then comes back, and therefore you end up with family members getting infected. Then you have to now deal with the entire family. Remember that also within this same family, there are different demographics. There are people who are elder. People in Kenya live in families where the mother lives with with their daughter and then lives with their children. So you are exposing more and more elderly people when you do that. So there is evidence that home isolation is not the best way to go. That actually isolation out of the community is the best way to go. Of course, it's a disruption. It is not fun to be away from your family for 14 days, but that's the only way to reduce the transmission. It is the way to reduce the transmission.
Let me ask this question. If we go by statistics that we've seen in the public domain, the vast majority of the people in this country are in the informal sector. And the dwelling places they have essentially is one room. Now, you've talked about accelerating testing. Yet, again, in that same public domain, we have issues with test kits, because there is a debate as to whether these test kits test accurately or whether the confirmatory tests also tests accurately. So, if we're going to talk about testing and we're going to talk about the numbers, this debate and the issues that arise, should they not be settled so that when people talk about testing, they are certain that the results of those testings are absolutely conclusive?
Now, my point is, my view is this, that people should not worry about whether there is sensitivity, whether there is false negatives, false positives. They should leave the public health specialists to worry about that. Because then,
if someone has COVID and the testing is not certain, they should leave the worry to the health specialists.
The test, when you're told the test is positive, what I'm saying is believe it's positive. Okay, that's all I'm saying. Don't worry about, are you sure? And what's going on is that many of the cases, when we do these tests, you also do what we call controls. So in a percentage of the people, you test twice. In a random sample of people, you test twice. So that you see whether you actually missed, maybe it was a false negative, and you'll be able to track that. So there is already, if you look at the numbers, you're looking at the US, numbers you're looking at Italy, they're the same test kits that are being used. It's not like Kenya has different test kits from Italy, from China, from the US. They are the same test kits. Even now, we are just importing kits from the US coming this week. We've received kits from Africa CDC. So the test kits are not like Kenya has doubtful test kits. They are global test kits.
It's not the Kenyan test kits. In fact, the issues around test kits have come from the very countries that these test kits are coming from.
Because in every scientific process, there will be research that shows, yes, there could have been percentage of this and that, this could have occurred. That doesn't mean that the majority of the test kits are going to be doubtful. It just means that science is continuously looking at increasing specificity. Even when you'd say, by the way, I'll give you antibiotics because you have pneumonia, I cannot guarantee you 100% that antibiotic will work on you. I may have to change it after some time. So that's how, medicine is not, what would I say, it's not an accurate science. And neither is physics or chemistry. So we say that, for example, when I treat you for pneumonia, when I treat you for diarrhea, I'll give you these drugs. Chances are 90% chance you will heal. But then many people will go back and say, no, this medicine failed because you had a high resistance rate. We are therefore changing the antibiotic.
Dr. You do have a valid point, and I agree with you. But the practice of medicine as a layman, I think, is based on empiricity. So it means it's something you can prove and something that is viable. But let me leave that aside. I think the work that you're doing is excellent. But what I'm actually asking is there a body of adequate communication that is actually being prepared if it isn't ready, that will deal with these issues? Because everything you've discussed is true, it is real, but if the communication is not accurate, it will not only fall on deaf ears, but all the efforts that we're speaking about will not amount to much good.
I hear you. So there's a lot of communication that is going to go out. My advice to the public is leave science to the scientists and just obey whatever has been proven to work.
Yep.
And what has been proven to work is what we are going to communicate. That hand washing works because this virus lands on surfaces. People then touch it with their face and then they put it on their mouth or their nose and they get sick. So that's proven. So follow those instructions. Cough, hygiene, it's been proven. Now, there are still debates about, for example, about masks. Should you use masks or not?
Yep.
Remember that this virus is new. It is basically 5 months. So do we have all the empirical evidence around this virus?
No,
we don't. We don't. And that's what we have to realize. So when people question whether you have full evidence on this, then you realize the virus of 4 months, we don't even have a vaccine. Then we have to work with what we have. You have to work with what we have to save the people from the troubles that could face them. And that's what we are working with.
And that's that is where the communication comes in. Also, the things that you and I are saying, the things that you are saying now, it has to be understood that there's a work in progress. I mean, clearly understood.
By everybody.
By everybody. Remember, if you're talking to a Kenyan, if a doctor says something, they're likely to believe everything you tell them.
Yes.
You say it, they believe you. Now, getting them to understand this is important, because with a new situation such as this one here, the myths and misconceptions, if not brought down, will take center stage. And then now, you'll be fighting it. Instead of communicating your message, you'll be busy fighting the myths and misconceptions. Like right now, if you're to talk to communities around the country, you'll be amazed at the myths and misconceptions that have taken center stage with the issue of coronavirus. And that's what people are going by.
I agree with you 100%. I have had people saying garlic works. I've had people saying there's a new traditional medicine from Ethiopia.
Yeah.
I've had, all these things. I totally agree with you. What you're saying is communication needs to be done. And I totally agree we could have done better. The government should do better. We are seeing now that people like yourselves are talking about it. This is, you're playing a role. By talking to your audiences, which are huge right now, you're already playing the role of actually clearing the myths and misconception.
Right.
Another radio station will be do the same. Another community health worker down in the community, we are training 60,000 of them. We'll be talking to their neighbors, telling them, by the way, this is the reality. So it's a continuous process, and you guys are playing your role, and we are playing our role, but we need to accelerate it because time waits for no man.
True.
Right, that's absolutely
Dr.
true.
As we conclude this conversation with you, the headline in today's Standard talks about doctors being afraid for Kenya. And it paints a picture of where the medical professionals working at the Mbagathi Isolation Center are saying how ill-prepared they were to deal with the first case and how they have been trying, to catch up with this. Now, let's look at countrywide, both private and public medical centers. Are we ready? Can we handle this? Are we talking about, when you talk about 50,000 people needing to be isolated and many more, 500 needing ICU centers, are we ready to handle this?
I would separate the two questions. I'll say, are we ready to handle this? No, we are not. Okay. Can we do it? Yes, we can. And those are two different philosophies. Let me explain. Are we ready to do this? Nobody has been ready to deal with corona. As Tyson said, you think you're ready until you get punched in the face.
Yeah.
So, and that's what the doctors find. That you have done a drill in the hospital. Everyone is aware, but you see, corona has no face. You see, you can't see it coming. So then you're sitting in your outpatient, you're seeing people with cough, with stomach pain, and then this person comes and you're like, this could be corona. And suddenly you're like, oh God, what did we learn? What were we taught? What are the steps? Who do I call? So this is what happens. And even now, even after we're training doctors, we're training nurses, training everyone, when the case appears, you saw a case where a patient appears and everyone took off.
Yes.
So the drill is different from reality. And therefore, that is why we are saying you will not be ready. You will only be ready from practice. And that is why you find that we are, the Ministry of Health is started off with the institutions that are already trained for infectious disease control. Because they have done these drills for Ebola, for yellow fever, for all these things. But in a normal outpatient somewhere in Kajiado, it is going to be very, very difficult. So we are not ready. And also remember that every time you think you're ready for Ebola, you are 10 steps behind where you think you are. Now, when we now get into the question of can we handle this? We can handle this. The only way we can handle this is for it to be, as you're saying, this whole thing about making sure that people have the information that they can use. And that is really critically important, which means that the corona fight is not a government fight. And I think even our Minister of Health and the government must realize it is not a government fight. It is a whole of society fight.
Yeah.
And the moment we shifted from being a government fight to a whole of society fight, to people owning it, to people realizing this is our fight. I was being sent photos from Busia. I asked somebody, a friend of mine there said, oh, people are putting water and soap outside their homes. They said, send me photos. They sent me photos from 9 homes where there is soap and water outside their house. In some of them, there's even a handwritten poster. Now, that's community ownership. That is not government going to put those hand washing centers there. This is where we need to reach, that people realize this is our fight. It's about me. It's about my family. It's about me taking measures in my own hand. That's where we need to reach. Then we can say, yes, we can handle this. But if we don't and we see it as a government fight and we wait for the government to make announcements and we wait for the government to save us, no, we will not be ready for it. Yeah.
Thank you very much, Dr. Githinji Gitahi, Global CEO, Amref Health Africa. We'll be speaking with you throughout this season. You've told us 5 months. So in those 5 months, expect a call from us every morning.
You have my number.
Thanks so much, Dr.
Thank you very much, Dr.
Thank you, guys. Thank you.
Cheers.
Fantastic show.
Asante.
Thank you. Bye-bye.
Thank you.